Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey friends, welcome back to Headed to Healthier. It's just me here with you today, and I thought we'd have a little bit of fun busting some myths. These are some common health myths that I hear or that my staff hears over and over in clinic. And there are certain phrases out there that people repeat just because they sound logical. Like some of them really do sound like they make sense. Or we say them because we've heard other people say them, we've heard them for years and years, and we just start to accept them as true. But here's the problem, at least with these 5 myths that I'm going to talk about today, is that sometimes these myths that we carry forward for years and years can quietly keep us from taking the best care of ourselves. They can really affect our overall health. So today I wanted to share 5 common myths that I hear all the time. And I'll tell you, I hear these sometimes especially from women who lead busy lives, have so many other things going on, and they sometimes, I believe, use these myths to justify maybe not doing everything we should be doing to take care of ourselves. So I'm going to tell you about these myths and give you a little bit of truth behind them. Now, don't worry, I'm going to keep this light, but as always, I want you to remember that this is just general education. I'm not giving you specific medical advice or talking to your personal situation. I just want us all to get on the same page as we're all headed to healthier. So let's dive into it. 5 myths that I hear or that my staff hears often. Now, this first one I don't hear as often, but I know that my staff hears it. And I know they hear it because I'll be walking by either the front desk or the nurse's station, and I'll hear them on the phone with someone. And I kind of smile because I can see the look on their face. And I know that their response is going to be exactly what we have talked about. So, myth number 1 is when patients say, I feel fine, so I don't need an annual checkup. This one we hear all the time. And the reason maybe that my staff is put on the spot to hear this so often is because once a year at least, and maybe even a couple times through the year, we do what we call running our list, meaning we look at our whole list of patients and we look at anyone who has not been there in the last year. So in the last 365 days, if you have not been in clinic, you're getting a call. And that call really is for us to clean up our list a little bit. Someone may say, hey, I moved out of town. That's why I haven't been there in a year. Or if they maybe change to a different physician, and that's perfectly okay too. But more often than not, it really is just that things have slipped their mind and they haven't called to schedule an appointment. So my staff will call and patients will say just that. I feel fine, so I don't think I need to come in for a checkup. But let's think about it. The truth is, annual checkups are not just about fixing problems. They really are more about catching those problems before they cause symptoms and before they cause issues down the road. Let's think about high blood pressure, for example. You can feel completely normal with blood pressures that are high enough to cause you a stroke or heart attack. This is why we call hypertension or high blood pressure the silent killer, because people can walk around feeling just fine and not realize that their blood pressure is through the roof. Diabetes, same story. Once your body adjusts to your sugars being high, you may have no symptoms at all. And those early changes that come with diabetes may be silent. So it's really important to get in for that yearly visit. The yearly visit gives us a chance to track your numbers and to look at trends over time. So one blood pressure reading 1 year on its own or a cholesterol number 1 year on its own doesn't mean a whole lot. But when we're watching how those numbers move year after year, That's where the story is. And so that is why annual checkups are so important. So if it's been a while, this is your gentle nudge to get that annual checkup scheduled, and not just get it scheduled, but to actually go to the appointment and get it done. So, myth number one that we hear in my office pretty commonly is I feel fine, so I don't need a checkup. Well, we have just named that as a myth, and we are not going to carry that one forward. The second myth that we hear, and this one I do hear from my patients, is if my cholesterol is normal, I don't need to worry about heart disease. And I wish that heart health was that simple. Cholesterol is important, and having a high cholesterol absolutely puts you at risk for having heart disease. But I want us to realize that cholesterol is just one piece of the puzzle. We've also got to take into account things like blood pressure, blood sugar, family history, smoking status. All of that matters when we talk about heart health. And here's something that many women don't realize: heart disease is actually the number one killer of women. Not breast cancer, not car accidents, it is heart disease. And so, while we certainly give all the attention that is needed to breast cancer and automobile and gun safety, I want us to also realize that heart disease is something that we have got to be looking out for and need to be monitoring even outside of just cholesterol alone. So, I don't want you to let having a quote unquote normal cholesterol trick you into thinking that you're automatically in the clear. I want you to really make sure that you're keeping the big picture in mind and, again, taking care of your overall health. Myth number three, and this one comes up a lot. I hear it from my patients, but more than anything, I hear it sometimes from friends or I hear it in social circles. So, myth number three is when women particularly say perimenopause just means hot flashes and mood swings. If only it were that simple, right? I had an episode recently. If you didn't listen to it, please go back. It was so good, with Dr. Sadaf Lodi. She is an obstetrician gynecologist in New York, and we had this full discussion on the podcast about perimenopause and menopause and what those symptoms look like. And if you'll remember, she talked about, yes, the hot flashes and mood changes that can be a part of perimenopause, but she also talked about those other things that come along with perimenopause, like the sleep changes, the shift in metabolism, the joint aches, even changes in your cholesterol and heart risk, all those things that come along with perimenopause. Because we have to keep in mind, hormones don't just affect our periods, they can affect our whole body. So if you're in your 40s and starting to notice that things feel just a little bit different, don't brush it off. It may be perimenopause. And one of the kind of shifts that we're starting to see in medicine is that there are options out there that are safe to treat those symptoms that come with perimenopause and menopause. So that's myth number three. Women saying perimenopause just means hot flashes and mood swings. That is not the case. It can mean so much more than that. Now, here's myth number four, and this one I actually heard in clinic just today. It's so wild. I prepared what I was going to say for this podcast a little bit this morning and made my outline, and then sure enough, a patient comes into clinic and she is talking about feeling fatigued, but kind of just blows it off. And she said something along the lines of, yes, I'm tired, but it's just due to normal aging. And that is myth number four. People thinking that all fatigue is just stress or aging. Now, I will admit, stress and age do play a role in how much energy we have. But if you are persistently tired, it's not something I want you to just push aside. And so, just like I told this patient today when she brought this up and kind of brushed it off, thinking, oh, I'm getting a little bit older, I'm just going to be tired, that's just the way it is, was that there are other things that we at least need to consider. Having fatigue could be related to being anemic, like maybe your iron's low. It could be thyroid abnormality. It could be vitamin deficiencies, like maybe she's low in vitamin D or vitamin B12. Or, and this is one that we really hit on, or it could be something like sleep apnea, which is so much more common than most people think. I will tell you just a little bit of a secret about me, and that is that I snore like I want to say like a grown man, but maybe I should say I snore like a hog. Like, it is ridiculous. And I know that there are times that I stop breathing in my sleep. It's wild. It's pretty insane. And so I went and got a sleep study done, and I wasn't even 40 yet when I got the sleep study done. So late 30s, got it done. They called back and were like, yes, Dr. Anderson, when do you want to go pick your CPAP up? Like, we are sending the order in friend, you need to go get this thing picked up immediately. And one of the things that I've noticed since wearing that CPAP is that I'm not tired when I wake up in the morning. And that was one of those things that we learned in our training. And, you hear people say things like if a patient has sleep apnea, they're going to come in telling you they're tired through the day and that they, quote, feel more tired when they wake up in the morning than they did when they went to sleep. And y'all, that is my real life. I started wearing that CPAP, would get up in the morning and have more energy in the morning than I even knew was possible. And so I bring that story up again just to show that all fatigue is not just related to stress. So it was no more of me thinking, oh, I'm just really tired because, I'm working so hard or I have all these things going on, which is certainly what I thought. But maybe there is actually something there. And not just something there, but something that can really be fixed. So if you're dragging all the time, I don't want you to settle for, well, I guess this is just my new normal. Get it checked out because sometimes, like I said, it's just as simple as correcting your vitamin levels or adjusting your sleep habits. So that's number 4. All fatigue is not just related to stress, and it's not just one of those things that's going to happen with aging. Get it checked out. So myth number 5, and this one does something to me when I hear it. This is my least favorite on the list. And that is when folks say to me as their whole physician, well, doc, I exercise so I can eat whatever I want. That is a myth from down under, that if you exercise, you can eat whatever you want. And I'll tell you, I wish this one was true too. If it was, I'd probably do a whole lot more walking and a whole lot more running than I already do. And I will make the point that exercise is incredible for your heart. It's great for your bones. It's great for your brain. And you absolutely should be getting in as much exercise as your body will tolerate. But I don't want you to think that exercising cancels out everything else you do to your body. Running for 30 minutes does not erase a day full of eating sugar and processed foods and doing other things to your body that shouldn't be done to it. Nutrition really is fuel for your body, and you want to make sure that you're making good nutrition decisions because this directly affects your blood sugar, your cholesterol, how much inflammation you have in your body, and of course, your weight. So I want you to think of it kind of like this. Exercise is medicine for your body's systems, but food is fuel for your cells. And these two work together, but they don't replace each other, which means you can't just assume that doing really great in one of them means that you can just go off the rocker with the other. So let's recap those 5 myths that we just busted. Number 1, feeling fine does not mean that you can skip your checkup. Number 2, having a normal cholesterol doesn't guarantee that you have a healthy heart. Number 3, peri-menopause causes way more than hot flashes and mood changes. Number 4, I want you to remember that fatigue is not always just stress or just related to aging. And number 5, just because you exercise does not mean that you get a free pass to eat whatever you want. So overall, keep in mind that knowledge is power, and I really hope that this episode gives you kind of a perspective on a few things that may have been floating around in the back of your mind. So if you've heard people say those myths that we mentioned earlier, then you are now equipped with the tools to bust those myths, to tell those people, hey, I heard this doc on a podcast that I listened to, and she said that is not the case. And if they don't believe you, share the podcast with them. Tell them to listen to this episode. And here's that reminder again, I'm not going to let this one go, guys. If you have been putting off getting your checkup, this episode is your sign. You have been waiting for a sign to say, hey, friend, you need to go get your checkup done. There you are. Hey, friend, you need to go get your checkup done. Thanks for hanging out with me today. Until next time, let's keep heading to healthier together. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.